If you're diabetic and trying to make better food choices, the truth is, not all nuts are created equal. Some can be your strongest allies, helping you lower blood sugar, fight insulin resistance, and protect your heart and nerves. But others, hiding behind sweet flavors or fancy coatings, can quietly spike your glucose levels, damage your kidneys, and sabotage your progress. So how do you know which ones to trust and which ones to avoid? Today, we're revealing the top 3 nuts every diabetic must eat and 3 surprising ones you should avoid at all costs. Get ready. This might just change your snack game forever. Let's begin with the top 3 diabetic-friendly nuts that don't just satisfy your cravings, but also support healthy blood sugar control and protect your heart, nerves, and kidneys. 1. Almonds. Almonds are a powerhouse choice for diabetics aiming to manage blood sugar naturally and protect their health while avoiding harmful spikes that come with high-carb snacks. Their glycemic index is 0, and glycemic load is very low, meaning they deliver energy steadily without causing blood sugar surges. A single small handful, about 23 almonds or 28 grams, provides nearly 6 grams of plant-based protein, 3.5 grams of fiber, and 14 grams of healthy fats, mainly monounsaturated, all of which help slow digestion and prevent post-meal sugar surges. These nuts also supply roughly 75 milligrams of magnesium, about 18% of daily needs, which plays a key role in improving insulin sensitivity, helping your cells take in glucose more effectively. Almonds are also rich in vitamin E, offering roughly 7 milligrams per serving, a powerful antioxidant that shields nerve endings, blood vessels, and soft tissues from diabetic inflammation and oxidative damage. That protection is vital in reducing the risk of neuropathy, especially in the hands, feet, and eyes. With around 76 milligrams of calcium and small amounts of zinc, potassium, and iron, almonds contribute to healthy muscle recovery, nerve signaling, and blood pressure regulation without overwhelming the kidneys, an important consideration for diabetics with early kidney changes. Their fiber keeps you feeling full longer, helping avoid late-night cravings that can lead to dangerous blood sugar swings while asleep. Still, portion control matters. Eating too many almonds can lead to excess calorie intake, potentially causing weight gain or worsening insulin resistance if not balanced with activity. These nuts are also relatively high in oxalates, which may pose a concern for those prone to kidney stones over time. A frequent mistake is choosing flavored or roasted almonds coated in salt, honey, or sugar that silently elevate blood glucose and negate the nut's benefits. The best practice is to choose raw, dry roasted, or soaked almonds with no added ingredients and stick to about 23 almonds per day as a healthy habit. To enjoy almonds in a way that supports diabetic health goals, try these 3 approaches. First, soak 10 to 12 almonds overnight and eat them on an empty stomach in the morning to enhance digestion and nutrient absorption. Second, sprinkle chopped almonds into plain Greek yogurt or sugar-free chia pudding to create a blend of protein, fiber, and healthy fats that stabilizes glucose before bed. Third, use almond flour as a substitute for regular flour in low-carb baking, like muffins or roti, to reduce glycemic impact while boosting nutrient density. Studies show that consistent daily almond intake can help reduce HbA1c by around 0.5% within 12 weeks, making it a small change with significant impact. Incorporating almonds thoughtfully into your routine can support better blood sugar control, stronger nerves, heart health, and kidney protection, all while satisfying your hunger and enhancing your overall well-being. 2. Walnuts. Walnuts are one of the most powerful nuts a diabetic can add to their diet, offering deep nourishment without raising blood sugar levels. They have a glycemic index of just 15 and a glycemic load close to 0, meaning they release energy slowly and don't cause blood glucose spikes. A 28-gram serving, which is about 14 walnut halves, provides 2 grams of fiber, 4 grams of protein, and around 18 grams of fat, most of it being polyunsaturated fat, including the essential omega-3 fatty acid alpha-linolenic acid. This type of fat plays a direct role in improving insulin sensitivity, helping your body respond better to insulin and reducing insulin resistance, a core issue in type 2 diabetes. Beyond healthy fats, walnuts contain magnesium, copper, vitamin B6, folate, and antioxidants like ellagic acid and melatonin. These nutrients support smoother nerve signaling, better kidney filtration, and lower oxidative stress in the eyes, helping reduce the risk of diabetic retinopathy. Their impact on the heart is also significant, as regular walnut consumption lowers LDL cholesterol, raises HDL, and improves blood vessel flexibility. For diabetics who are already at a higher risk of heart attack or stroke, this makes walnuts a strategic choice. Walnuts have also been found to improve insulin signaling pathways by supporting fat metabolism in the liver and improving insulin receptor activity in muscle cells, both of which help enhance insulin sensitivity. In some trials, regular walnut consumption has been linked to a modest but meaningful reduction in HbA1c, around 0.3 to 0.4% over several months. The recommended amount for diabetics is one small handful a day, or about 7 to 10 walnut halves, ideally eaten raw or dry roasted. Going beyond that can backfire, especially because of their calorie density. Overeating walnuts may cause weight gain, and in some people it can trigger bloating or digestive discomfort due to their high fat content. A common mistake is mixing them with sweetened trail mixes, where hidden sugars cancel out the benefit. Another issue is roasting walnuts in oil or adding too much salt, which increases the risk of blood pressure complications, especially in older diabetics with kidney concerns. To enjoy walnuts in a way that supports blood sugar control and body repair, start with a simple evening snack of plain walnuts paired with a few slices of avocado, which makes a blood sugar steadying, magnesium-rich plate. Another excellent option is blending walnuts into a homemade unsweetened walnut milk, which can be used in smoothies or chia puddings to add healthy fats without added carbs. You can also mix crushed walnuts into cauliflower rice or lentil-based salads, giving texture and heart-healthy oils without spiking glucose levels. What makes walnuts such a powerful night food for diabetics is their ability to nourish the nervous system, lower overnight sugar swings, and support calm, stable sleep. And in the bigger picture, this quiet impact adds up. Over time, walnuts help reduce nerve inflammation, stabilize metabolism, and protect the small blood vessels in the kidneys, eyes, and heart that diabetes puts under constant stress. For diabetics aiming to improve their numbers and protect every corner of the body, walnuts aren't just safe, they're smart. 3. Pistachios. Pistachios stand out as an excellent nut choice for diabetics because they offer a rich nutritional profile that supports balanced blood sugar without triggering harmful spikes. With a very low glycemic index of 15 and minimal glycemic load, pistachios help keep blood glucose levels stable when consumed in appropriate portions. A standard serving of about 1 ounce, or roughly 49 kernels, provides around 160 calories packed with healthy fats, mainly monounsaturated and polyunsaturated fats, along with 6 grams of protein and 3 grams of fiber. This nutrient mix slows down digestion and sugar absorption, which reduces the risk of sudden blood sugar surges after meals. Beyond blood sugar control, pistachios deliver a significant amount of potassium, which plays a key role in managing blood pressure and supporting heart health, both critical concerns for people with diabetes. They are also a good source of vitamin B6, essential for healthy nerve function, and can help alleviate symptoms related to diabetic neuropathy, like numbness and burning sensations. The nuts are loaded with antioxidants such as lutein and zeaxanthin, which are vital for protecting eye health and lowering the risk of diabetes-related eye damage. Regular consumption of pistachios has been linked to improved insulin sensitivity, which means the body can use insulin more effectively, leading to better control over blood sugar and a potential reduction in HbA1c levels, an important marker for long-term diabetes management. Eating pistachios may also improve cholesterol levels by lowering bad LDL cholesterol and increasing good HDL cholesterol, reducing cardiovascular risks that diabetics often face. Additionally, their anti-inflammatory properties help protect the kidneys by reducing oxidative stress and inflammation, factors that contribute to diabetic kidney disease. The fiber in pistachios supports digestive health and promotes a feeling of fullness, which can prevent overeating and help maintain a healthy weight, crucial for managing insulin resistance. The ideal daily intake is about 1 ounce of pistachios. Consuming too many can lead to excess calorie intake and possible weight gain, which negatively affects insulin sensitivity. Overeating may also cause digestive discomfort because of the high fiber and fat content. A common error is choosing pistachios that are salted, flavored, or roasted in oil, which adds extra sodium and unhealthy fats, potentially increasing blood pressure and blood sugar levels, harming diabetic control. For diabetics, the healthiest ways to enjoy pistachios include eating them raw or dry roasted without salt, adding them to salads or Greek yogurt for a nutrient boost, or using pistachio butter as a nutritious alternative to sugary spreads. They can also be chopped and sprinkled on steamed vegetables or blended into smoothies for added texture and antioxidants. These approaches maximize the health benefits of pistachios while keeping blood sugar levels steady and protecting vital organs like the heart, nerves, and kidneys. Overall, pistachios offer a delicious and natural way to support diabetic health every day. Now that we've seen the top 3 blood sugar-friendly nuts your body truly loves, it's time to look at the other side. Some nuts may look healthy, but they quietly raise your sugar and harm your nerves. Before we dive into the worst picks, hit that subscribe button so you never miss out on powerful diabetic food tips that protect your heart, kidneys, and energy every single day. Let's uncover the 3 worst nuts diabetics should avoid. 1. Honey roasted or sugar-coated peanuts. Honey roasted or sugar-coated peanuts might seem like a delicious snack, but for diabetics, they carry hidden dangers that can seriously disrupt blood sugar control. These peanuts are loaded with added sugars, sometimes up to 12 grams per ounce, and often roasted in oils that increase unhealthy fat content. This raises their glycemic index to around 60 to 70, which is considered medium to high, and their glycemic load jumps close to 15 per serving. Such values mean these nuts cause sharp blood sugar spikes soon after eating, which can wreak havoc on both fasting blood glucose and post-meal glucose levels. This roller coaster of blood sugar raises insulin resistance and decreases insulin sensitivity, making it harder for the body to regulate glucose properly. Over time, this leads to higher HbA1c levels, a marker of long-term blood sugar control, increasing the risk of severe diabetes complications. Nutritionally, plain peanuts provide about 7 grams of protein, 2 grams of fiber, and healthy fats per ounce, which helps slow carbohydrate absorption and stabilize blood sugar. However, honey-roasted peanuts lose much of this benefit due to their high sugar and fat content. The excess sugars add empty calories that promote weight gain and fat buildup, especially around vital organs, which worsens insulin resistance further. The oils used in roasting often contain unhealthy trans fats or oxidized fats that raise LDL cholesterol and triglycerides, putting extra strain on the heart. For diabetics who already have an elevated risk of cardiovascular disease, this combination accelerates heart damage and increases the chance of heart attacks or strokes. Moreover, the inflammation triggered by sugar overload and unhealthy fats worsens diabetic nerve damage, causing painful neuropathy symptoms like numbness, tingling, and burning sensations. The high salt content often found in honey-roasted peanuts, sometimes over 150 milligrams per serving, elevates blood pressure, harms kidney function, and worsens diabetic kidney disease. This trifecta of blood sugar, spikes, inflammation, and high salt significantly stresses the nerves, heart, and kidneys, all organs vulnerable in diabetes. A safe portion size of honey-roasted peanuts should be no more than 1 ounce or about 28 grams, but even this small amount can lead to dramatic blood sugar fluctuations. Overeating these nuts compounds these effects, causing weight gain, worsened insulin resistance, and higher risks of cardiovascular and kidney complications. Many diabetics make the mistake of thinking honey-roasted peanuts are a healthier nut choice due to the peanut content, but the sugar and unhealthy fats make them a risky snack. This misconception often leads to frequent consumption, undermining blood sugar management and increasing health risks. 2. Salted cashews. Salted cashews might look like a convenient and tasty snack, but for diabetics, they carry serious hidden risks that often get overlooked. While plain cashews have a low glycemic index of about 22 and a glycemic load around 3 per ounce, making them relatively safe in terms of blood sugar spikes. Salted cashews are a different story. The added salt, often around 180 milligrams of sodium per ounce, significantly increases the risk of high blood pressure, which is a major concern for diabetics already vulnerable to heart and kidney complications. Excess sodium forces the kidneys to work harder to filter out waste, worsening diabetic kidney disease and accelerating kidney damage. The strain on kidneys also disrupts fluid balance and blood pressure regulation, which can further impair overall metabolic health. Moreover, salted cashews often contain oils used in roasting that may be high in unhealthy trans fats or oxidized fats. These fats increase systemic inflammation and reduce insulin sensitivity, making the body less effective at using insulin. This leads to worsening insulin resistance, causing blood sugar levels to rise more sharply after meals, and increasing the risk of dangerous blood sugar spikes. Over time, this negatively impacts HbA1c, a critical marker for long-term blood sugar control, pushing it higher and raising the risk of serious diabetic complications. Nutritionally, cashews do offer valuable benefits, such as about 82 milligrams of magnesium per ounce, which supports nerve function, muscle relaxation, and helps improve insulin action. They also contain heart-friendly monounsaturated fats that can lower bad cholesterol and support cardiovascular health. However, the excess sodium in salted cashews counteracts these benefits by promoting hypertension, which strains the heart and blood vessels. For diabetics, this combination elevates the risk of heart attacks and strokes, already leading causes of death in this group. Eating too many salted cashews can also lead to fluid retention and swelling due to high salt content, making blood pressure management more difficult. Inflammation triggered by added salt and unhealthy fats can worsen diabetic neuropathy, leading to symptoms like pain, tingling, or numbness in the extremities. This impacts nerve health and reduces quality of life. Another problem arises when diabetics unknowingly consume salted cashews frequently, believing all nuts are healthy, but the added salt and oils silently undermine their efforts to control blood sugar and protect vital organs. Portion control is crucial. Limiting salted cashews to no more than 1 ounce per day is advised to reduce these harmful effects. Avoiding frequent consumption and choosing unsalted or raw cashews instead can help maintain stable blood sugar and protect heart and kidney health. 3. Flavored or chocolate-covered nuts. Flavored or chocolate-covered nuts may seem like a fun snack, but for diabetics, they can quietly sabotage blood sugar control and worsen long-term health. These nuts often start as a healthy base like almonds or peanuts, but once coated in sugar, caramel, chocolate, or even artificial sweeteners, they turn into a dangerous blood sugar bomb. Just a small handful can contain over 12 to 18 grams of added sugar, which rapidly raises post-meal glucose, spikes insulin levels, and increases HbA1c over time. The glycemic index of these treats can climb beyond 55 to 70, depending on the coating, and the glycemic load shoots up from the safe range into the red zone, making them risky for anyone trying to manage diabetes. These nuts are often roasted in unhealthy oils or processed fats, which worsen insulin resistance by increasing inflammation and disrupting normal glucose metabolism. The combination of sugar and saturated or trans fats puts extra pressure on pancreatic beta cells, making it harder for the body to produce and respond to insulin properly. This not only increases daily blood sugar levels, but also leads to wider glucose fluctuations, which are especially damaging to the nerves, blood vessels, and kidneys of diabetics. Over time, such fluctuations accelerate the progression of diabetic neuropathy, leading to burning, tingling, and loss of sensation in the feet and hands. When it comes to cardiovascular health, these snacks are a double threat. The added sugars raise triglycerides, while the unhealthy fats increase bad cholesterol, LDL, and reduce good cholesterol, PHDL. This inflames artery walls and raises blood pressure, putting diabetics at much higher risk for heart attacks and stroke. Meanwhile, kidneys suffer from increased workload and oxidative stress caused by elevated blood glucose and inflammatory load, which can speed up kidney decline and eventually lead to diabetic nephropathy. Many chocolate-covered nuts also contain preservatives, flavor enhancers, and refined carbohydrates, all of which contribute to higher oxidative stress and damage sensitive tissues. A common mistake diabetics make is thinking a small portion won't hurt, but even one serving of these sweetened nuts, often just 1 ounce, can contain 150 to 200 calories, mostly from simple carbs and fats, which provides very little satiety and can lead to oversnacking. Overeating them, especially at night or without reading labels, leads to weight gain and worsens insulin resistance. Artificial sweeteners used in sugar-free coatings are no better, as they still trigger insulin response and may cause digestive distress or blood sugar variability. If you're craving nuts, it's far safer to stick with raw or dry roasted unsalted varieties, which provide the natural benefits of fiber, magnesium, healthy fats, and antioxidants without the harmful sugar and chemical load. In the case of flavored or chocolate-covered nuts, the appearance of health is misleading, and the hidden ingredients can quietly undo days of careful sugar management. Small choices like skipping sugar-coated nuts can make a big difference in protecting your blood vessels, nerves, heart, and kidneys from the damaging effects of poor glucose control. If you found this helpful, don't forget to like, share, and subscribe for more simple yet powerful tips to manage your diabetes naturally. Drop a comment if you've tried any of these nuts or want to know about others. Your journey to better health starts with smart choices, and we're here to guide you every step of the way.